Kate, we're going to go to you next is Dr. Kate Mulligan. And so Kate is with the Alliance for Healthier Communities. And so Kate works with community health centers across Ontario. And we've asked Kate to speak to two questions. What are the key equity and social determinants of health priorities you're addressing in your work? And what are you seeing as some of those promising policy and programmatic responses to COVID-19, which really have an equity lens as part of them, which are really acting on a whole host of social, structural, and economic determinants of health? Kate, on to you.
Very much value your time in this middle of this crisis, and I know you're all working very hard. So I'm a health geographer by training, and my orientation is as a political ecologist of health. And so like Angela and many of you, that means I understand health to be produced at that intersection between our material and our social environments. And COVID-19 is an example of that sort of a biophysical phenomenon and social phenomenon that's filtered through systems in which some of our lives are deemed more essential or more valuable than others. And that is one of the key challenges that we face in centering an equity approach in our work. On the happier side, I wanted to share a quote from the prominent medical anthropologist Paul Farmer, who said that diseases that predominantly affect the poor are unlikely to garner funding or attention until they emerge onto the consciousness and space of the non-poor. And I think that can be generalized across a number of equity dimensions, that what we are seeing is an emergence into the consciousness and space of the non-poor or the non-marginalized of some of the issues that many of us have been working on for a very long time. And so we need to make sure that an emergency response is in place for people who are marginalized or medically vulnerable. And we also need to leverage that opportunity to move forward into a more equitable, more sustainable and healthier future. So the Alliance for Healthier Communities, as Sime said, is a network of community health centers, Aboriginal health access centers, and other primary healthcare organizations that provide health and social services under one roof. They're run by and for communities, and they have an explicit focus on health equity and on serving marginalized people. And they know that many people from the Alliance and from community health centers and Aboriginal health access centers are on the line today. And thank you so much for being here. Please share your direct experience and expertise in the chat box. I want to run through very quickly some of the key issues that we are working on right this moment with respect to COVID-19. So one of the key ones obviously is emergency primary health care. So making sure there's enough personal protective equipment, masks and gowns and so on for frontline healthcare providers who work with marginalized populations. And that's particularly acute right now for the consumption and treatment services and overdose prevention services. So places that provide supervision for people who are using drugs, they have faced profound and critical shortages of PPE. A few that are not Alliance members have actually had to close over the last couple of weeks due to staff shortages and an insufficient amount of personal protective equipment. And that puts people at risk of, people who use drugs at strong risk of overdose and opioid poisoning. So this is a very critical issue. So those are some of the things that we're doing. And the centers are also pivoting to a virtual approach to primary care and a virtual approach to social prescribing, which means using the healthcare visits to, including screening for COVID-19, to refer people to social supports and services. So that might be providing active outreach to the very isolated and marginalized people that we know of and that are part of our communities, and providing material needs like food or shelter or cell phones for people who are cut off from access to digital services that they might have been using in libraries or community health centers and that kind of thing. So that's one of our primary needs, but we're also working on a fair bit of advocacy as well. My colleague Sane Dubé is on the line and has provided fantastic leadership on a lot of this work. So, for example, housing. The United Nations has said that this is the most important front in the COVID-19 response. Angela spoke to this as well. There's really, what we're finding is that there's a need for essentially coordinated shelter supports so that people can self-isolate. That means providing hotel rooms for people experiencing homelessness or precarious housing, for example, and including that they have the supports like food, medical aid, mental health support, and a safe supply of prescription medications. So that's one of the things that we continue to be working on. And what we're finding is that when there's a region by region or municipality by municipality or public health unit by public health unit approach, it's very difficult to get things done. It's very difficult to make sure people don't fall through cracks. So we're advocating very strongly for central directives and support. Harm reduction is another one I've mentioned already. We have an open letter about providing safe supply of drugs for people, and that open letter, Sumaya is going to be sharing in the chat box. It's going to be closing to signatures at the end of day today, so if you are able, please do sign and share this letter. We're asking for Ontario to follow British Columbia in ensuring that people can have access to a regulated and safe supply of prescription opioids and other medications that they need in order to be able to safely self-isolate and avoid the dangers of unregulated markets. We are also working on migrant agricultural workers on whom our food supply very much depends. So again, we need a provincial-wide directive and sufficient resources so that local public health units can enforce health and safety in these areas, and that community health centers can provide health care to migrant workers. We're working on corrections, making sure that people who are newly released from prisons, and we may see more of these over time as social distancing becomes increasingly challenging, that people who are newly released get the primary health care that they need, and community health centers provide that in many cases. So we need a clear strategy for their release and for the provision of their health and social care. We've been working on work and income supports like fair sick leave and sick note policies, making sure federal benefits aren't clawed back from people on income and disability benefits, and making sure that both paid and unpaid caregivers have access to that personal protective equipment. And finally, we are continuing to do research, and we're reaching out to every single member in our network about what they're doing, how they're pivoting to virtual, what their needs are, and so on. And we will be publishing some of that research as soon as we can as we get through it. So I will stop there. Those are just a few of the issues that we are working on. I'm really happy to talk more about it with anyone who is interested. Thanks.
Great. Thank you so much, Kate. I think the work you do at the Alliance of Healthy Communities really shows us how we can take care of some of those very immediate needs and still keep our gaze and our action on things which are also very structural, things like housing, which you mentioned, safe supply, and all those. So thank you for that. We have dropped the link for the open letter Kate just mentioned in the chat box, so you can see it there. And her colleague Sunny will also shared the link there. Thank you.